Good evening, everyone. How are you all?
Good, doctor. How are you?
Well, I'm good. Thank you. So, welcome to First Aid AMC Clinical free 2 week sessions. So, this is the first class of our free 2 week session, as you most of you might know. So, First Aid AMC Clinical always allows these 2 weeks free sessions for everyone, whether you are our course students or not. You get to listen to our class, you get to see how we conduct classes. And the reason why we offer this is to make sure that you become satisfied that yes, this is the course I want to join because I feel it is useful for me. So that's always important. I always say that if you are going to join a course, make sure you know how they teach, make sure you're satisfied enough to start the course because it takes a lot of money, it takes a lot of effort and time as well. So you can't just like like join a course without knowing how the classes are going to be. So these free 2 week sessions will help you to understand us. And also, even if you are not our course students, you'll get to understand the basic of AMC clinical preparation, which will help you immensely during your next few months of preparation. Because these classes that we do in the 2 weeks, these are very, very important topics. We do these psychiatry sessions, which is like super important. We do cardiology. You will get to see some of our role play sessions, which will be random role play. So you'll get a taste of everything that we do in this 2 week session. There will be another class, which is also free for everyone. That's a pathway of registration to become a doctor in Australia. That is one of the most important classes that you need to attend. So we have made our mind that most likely this is going to happen at the end of January. So probably 31st of January is going to be that class date, but you will get notified in our Facebook group. So tonight's session is nothing but the role play session based on the session that we had in our trial class. I hope most of you joined our first trial class that we have taken a couple of weeks ago, where we discussed about the psychiatry mental status examination. And we also gave you a very good idea that how face-to-face exam is going to look like, how to start your preparation. So I'm hopeful that it was a very well-informed session, right? I try to keep you muted during the class just to make sure that, like, sometimes people can talk and they might not even notice that they are talking and we can hear everything. So it's just a good idea to keep everyone muted for the moment. Okay. But if there is any confusion, any questions, feel free to write it in our chat box. I'll be happy to answer you anytime. Those of you who are in our, I can see a few of you are in our Facebook group where you are just watching as a live session. Understand that the classes are happening on the Zoom. We have provided the Zoom ID and password as well, so you can easily come into the Zoom session, which is much more interactive because you can actually role play with me during these sessions. You can't do role play if you are on a Facebook live session. Okay. So if you want to do role play today, just come to our Zoom class and that will be really important, right? So today we are not going to waste a lot of time to give the introduction or anything. Today we are mainly focusing on this psychiatry session to give you an idea that how you should do role play because role play is going to be the pillar of your preparation for AMC clinical. Candidate who tends to do a lot of role play with their study partner, they're the one who pass the exam in the shortest possible time and mostly in their first attempt. So there is no alternative of role play. You have to find some study partner. You have to make sure that every case that we do in our class, you should definitely do a role play with your partner. All right. But today you will get an idea that how role play works, how it should be done. and then you can start it. Yeah, so all of our classes are recorded. So if any of you can't join the live sessions, we will always record the session and it will be provided. The free 2 weeks, these classes will be provided in our YouTube, and also the link will be provided in the Facebook group. So there is lots of way that you can watch these video recordings later on, even if you miss this class. Same thing we did in our trial class as well. Okay, now, so we will discuss a little bit about how the first aid AMC clinical course is going to work at the end of our tonight's session. So if you want to know a little bit more about the course, make sure to stay at the end, and we will also do a question and answer session. Okay? So who wants to do the role play in here? I would like to encourage someone who has already done a little bit of preparation, who might be in the middle of your preparation, so you know how to do role play, so that others can get some idea. So, and after that, we will allow even someone who is new. So if any of you who might understand how role play works, I would appreciate if you just want to do a role play with me. Dr. Min, yes, definitely. Let's unmute here.
Yes, doctor.
Yes. So Dr. Min, how are you doing? Good?
Good, doctor.
I can't hear you properly. Let's see, so where are you located?
Here, do you hear well, doctor?
I can hear you. Yeah, that's good now.
Yes.
Okay, so for the role play class, all the role play that we are going to do will be you get 2 minutes to read the case and think about the case. And after that, we do 7 minutes, 30 seconds. Although you get 8 minutes in the exam, but because you lose some time during the initial introduction, always when we do role play and you are going to do role play, it will be 7 minutes, 30 seconds. Okay. So I'll give you
Yes,
the
doctor.
case just in a bit. A very classic case. So your 2 minute time just started.
Yes.
All right, doctor. So you have got Sam with you. So he's your patient. You can start.
Okay, doctor. Good afternoon. I am Dr. Min, one of the doctors here.
There is so many cockroaches. Uh, oh my goodness. Who are
Okay.
you? Sorry again.
I am Dr. Min from this ward.
I don't care who you are. Can you please
Yeah.
just call someone? Just get this cockroach out from this room. This is a
Okay.
hospital. How come there is lots of cockroaches in this room? I'm just
Okay.
going to get infection from here. So just just clean this room for a sec.
Okay. Where are they?
It's everywhere. Can't you see? Like it's even just one near to your foot. Can't you see that?
Okay. I will ask the one cleaning staff to clean that for you. Okay.
Just ask them now because I can't just wait in this room. We just need to you can give me some other room, but this is a filthy hospital. How can I be in this room? I
Uh,
paid privately for this surgery, and that's how you are going to pay for me?
Okay, I understand your concern. Please don't worry that. I will ask the one staff to clean that one. And how long have you been seeing these cockroaches?
Just since this morning, it was all good last night, but since this morning, it's all over in my place.
Has it happened in the past?
No,
Okay, okay. So do you know where are you right now?
yes, I'm in the hospital, which is like a filthy rubbish thing in here.
Okay. Do you know why are you here?
Yeah, I had the surgery, which no
Okay,
one bothered to ask that how my surgery went or anything, because
okay,
not even the nurse came since morning because they don't care.
okay. Do you have pain right now?
No, I'm okay.
Okay, how can I address you?
I'm Sam.
Okay, Sam, nice to meet you. Uh, Sam, I want you to know that today our conversation is private and confidential. I will ask the same question for you. Is that okay for you?
Yeah.
Yeah. I see that you see the cockroaches. And do the cockroaches crawl over you or on the table?
It's crawling on me, and even on your shirt, there is a cockroach. Just throw it away.
Okay. So do you hear the thing that the other people see or hear it? Cannot see or hear it?
No, I can see, as you can see, you can see the
Okay.
cockroach, right?
Um, at first, we have to discuss about the mode issue on that matter. Please don't worry that, and I will ask the same question for you. Is that okay? It will take a few minutes.
Okay.
Okay. So, Sam, how are you moved during these days?
I'm just quite angry at the moment. I was fine.
Okay. So how about your sleep and appetite?
Yeah, it's okay.
Okay, good. So the same question why might be the weird, but I will ask to the all patient for the screening. For this matter, I would like to add that one. Do you think life is worth living or worth less?
Yeah, definitely.
Okay. Do you have any idea of harming yourself or harming to the other?
No, why I would do that?
Okay. So have you felt that thought of being inserted into your mind?
No. Do you
Okay.
think I'm insane?
Okay. Have you experienced that thoughts are being taken out of your mind?
No.
Okay. Have you felt that other people are aware of your thoughts?
No.
Okay. Have you experienced the voices of people echoing your thoughts?
What kind of questions are these? Why am I asking, like, why am I answering these
Uh,
questions? It's
yes,
insane.
I
I
understand
haven't
that.
seen any cleaner coming so far. It's been 5 minutes. There is no one even bothered to come to clean this room.
Okay.
And more cockroaches is coming towards me now.
Okay. I'm calling the one step to clean the cockroaches for you. Please don't worry that. Please keep calm. And I would like to know some just screening question only for a few days, only for a few minutes. Please don't worry that.
Okay.
Okay. Um, do you feel that you are special with unusual activity and power?
No.
No. Okay. Do you feel that someone is spying on you or trying to hurt you?
No.
Okay. Do you think that you have been experiencing, you have seen or have done something deserving punishment?
No.
Okay. Do you think you need help for your medical problem?
No, I don't need anything for that, but I really need someone to clean this room.
Okay, okay. So this is just a hypothetical question. What would you like to do if you smell smoke while sitting in a cinema?
I'll just run away.
Okay, that's great. What day is it today?
Can't remember. It's in the hospital. I can't even see anything.
Okay. Can you estimate what times is it?
It's in the evening.
Okay. Can you recall my name?
No.
Okay. I would like to tell you three things. Please remember, please tell me that three things after I have finished. Remember in your mind, I will ask you a few minutes later. Is that okay?
Yep, sure.
Okay. Orange, camel, table. Okay?
Yep.
Okay. So I would like to ask the one question that can you spell the word backward in WORLD word?
Just word or world?
Pardon?
Word or world?
Word. WORLD world. Can you spell
Yeah.
backward that word?
Yeah, DLROW.
Okay, thank you. Okay. So can you remember that three things previously I mentioned earlier?
Yep. Orange, camel, table.
Okay, thank you. So I would like to ask the same private question, and this might be related to your underlying condition. Can you tell me more about your home situation?
Yeah, it's okay. I just live with my partner.
Okay. Any stressful condition at home and work?
No.
Okay. Do you drink alcohol?
No.
I saw a note that you had been the long history of alcohol drinking.
Yeah, I sometimes drink. Just don't want to talk about it.
Okay. By any chance,
Time up, doctor. Time up, Dr. Min.
Okay,
Okay.
thank you.
So, what did you? So you did really, really good. I'm so happy with how you like were maintaining the calmness. That's really important for this kind of case. So really, really good. Okay.
Yes.
So the problem is that you kept on asking questions for a long time because you have 7 minutes 30 seconds and you still couldn't finish the history. So the feedback for you would be that you have a very perfect way of asking questions, reassuring everything. And even you don't get bothered about the role player pressuring you, asking you lots of questions. So that's really important for psychiatry because you can't get offended by the role player or even the real patient, right? So they will say a lot of things, but you can't get offended. You need to keep on constantly reassuring them. And that's what a examiner also wants from you in the exam. So if someone gets offended, that's the time they fail. So definitely, it is a case of mental status examination. You don't need to do the mini mental status examination, which is that MMSE. And the main thing you added in the existing MSc is asking that world backwards, then those three words, those are not really needed for this MSc because those are not a part of MSc as well. If your task is to go for like present MSc plus MMSc. That's the time you can add these two. Otherwise, there is no need. Okay, we haven't discussed the MMSc yet. So, but you did ask about a few things from MMSc, which is definitely not needed for this case. So remove all these things. So all you need to make sure that aseptic J3R, if you have got all the information for that, you can just go to the next task. Because if you do a very good history, but still you can't finish it in time, they won't pass you because presenting MSc is really important.
Yes.
So just cut off everything. So when you come to, let's say, so you need to find out the insight, cognition, judgment. And once you finish with the judgment question, if you think that, well, the role player did not waste a lot of time, then you can finish with asking about the alcohol and smoking history, past medical and family history of mental condition. That's it. And you can finish there. No need to go to anything else. Okay.
Okay, doctor.
Now, do you think you can present the MSc in, let's say, in 2 minutes?
Yes, doctor.
Okay, let's do it.
Okay. Thank you, Sen. Please wait for a few minutes. I will come back after discussion with my examiner. Dear examiner, I would like to request the mental state examination of my patient. who is presenting with the sudden onset of odd behavior after the surgery. On assessing of the general appearance, he is wearing the clothes appropriate to the weather. He is well grown and his facial expression seemed to be distraught. And he think that he see the cockroaches throughout our conversation. And he went to mention that he went to clean the rooms. And he is not well engaged. His behavior seemed to be distracted and he is not well cooperated at some extent, but he can answer all the questions I asked him. And on assessing of the speech, he is talking with the normal tone, no pressure speech, no loud voice. He is talking clearly. And however, the rate of the speed is occasionally with the interruption as the patient is react to the presence of the cockroaches. On assessing of the emotion, sometimes he feel frustrated and anxious because whenever we have to the perceived cockroaches. On assessing of the effect, it seemed to be disturbed. On assessing of the perception, he has the visual and tactile hallucination because he is seeing cockroaches running around and over him, but he denied the auditory hallucination. The patient doesn't have the thought insertion, thought withdrawal, thought broadcasting, and thought echoing. There is no flight or idea. Assessing of the thought content, he has the delusion of persecution because he is suspicious of the just like cockroaches is running around the one, and another the hit insight is impaired, and insight is compromised by that perceptual disturbances. His conscience is good. He is well orientated to the time, place, and persons. And memory is good. Attention is also good. He has a risk of suicide and homicide at this moment because he has the hallucination. And I need to get the history from the medical note, his friend and family to be reliable for the good history. Thank you, doctor.
Okay. Thank you, Dr. Main. So still, I feel like you have done it really good, but still I feel it's too long because you might not get that much time in the exam, especially psychiatric cases are very long case. The role player usually interrupt a lot and it becomes difficult to finish with a history even. So make it more short and in a way that you include everything, but just cut off the things that is not going to that it's not going to affect your marking in the exam. Like if I am going to do it because you can't actually see my face. So for every case that we are going to do today, the appearance just say normal. But in your exam, you would see the person and you can just mention what their appearance looks like. So let's say I will say that, dear examiner, I'm going to present the mental status examination of a 47-year-old patient who just had a right shoulder surgery and he's behaving oddly in the ward. In terms of his appearance, it seems well-groomed. He is not cooperative most of the time, but he was answering questions appropriately. He seems All right, guys. Sorry, I think somehow my network dropped. So let me just start again. Just 1 second. All right, sorry for the interruption. So I was just discussing how I was going to do the MSc for this case, right? So let me continue. So for this particular case, Dr. Min has done really good, but I feel that you still need to reduce the amount of sentence that you can use during this whole case, because most of you will run out if you try to explain or if you try to add everything, because this exam is not about getting the highest mark in everything. It's about finishing the task in time and getting a pass mark. So that's what we want from you, that if you can do that, you're good. If you pass the station, even if you just pass it, it's fine. So in this case, I would rather start like this. So you guys can hear me well, right? Yep, brilliant. So we will say in here, so dear examiner, I would like to present mental status examination for a 47-year-old patient who presented with a disturbed behavior of following a dislocated right shoulder surgery. As part of his appearance, he looks well groomed, but he was not behaving like normally. He was quite disturbed by the presence of the cockroaches. As part of his speech, it was normal in tone, volume, but there was no disorganized speech. At times, it was a bit loud, but he was answering questions appropriately. Emotion, he said he is angry, and the affect that I have observed is congruent with his mood. As part of perception, he had visual and tactile hallucination. Thought form was linear. As part of thought content, he did not have any delusion. Insight was not intact. Cognition, he was oriented to time, place, and person. Judgment, judgment was also intact as well. I was able to maintain a good rapport with my patient. He is in high risk because he has active hallucination, and because of that, I would like to take a collateral history from surgeon or nurses just to make sure that he's giving the right history. Thank you, examiner. So the thing is that you can finish this within a minute, or you can prolong it to 4 minutes also. So it always depends how much time you have in the exam. And when you do a lot of role play, you get to understand that. You get to feel that yes, I have lost a lot of time because patient was really bad. He was not answering questions. In depression case, they just pause. They don't answer anything. So it takes a lot of time. In those situations, it's better to just short it. So if you can, so you need to know how to prolong an explanation, and also you need to know how to make it shorter because you might need it. So if if I was in this case, I would take a good history like Dr. Min has done, reducing the amount of time to, let's say, 5.5 minutes, and I would keep 2 minutes to present the MSc. And if we want to finish MSc in 2 minutes, then it has to be a bit shorter. We can't go too much long. Okay. And in some cases, Along with these two tasks, they also added diagnosis and differential diagnosis. So it becomes very tricky in that time because you would not have enough time to do three tasks in this kind of case. So if that is the case, definitely MSc needs to be shorter. Okay. So did you guys get an idea that how role play works? Dr. Mean is a very good example of how to do the history. So the history that he was taking perfect. Just to make sure that that's the beginner mistake that you want to ask everything. You want to make sure you don't do anything wrong in the exam. So that's the time you will run out of time. The smart way is to ask the important thing and forget about anything else. I don't want to get like, because every task you would get 0 to 7 mark, right? And out of 7, if you just get 4 in this task and 4 in this task, as a global score, you will get 4. And if you get 4, you pass that station. So your idea should not be like, let's get 7 in the history and 1 in the MSc. Even if you average it, it becomes 4, but that will not work in the exam. Okay? You have to get pass mark in most of the tasks. That's the time you will globally pass that station. Okay? Any questions in this case? So in this case, if we start with the history, first you go in, you introduce yourself, you reassure the patient that yes, you are going to call a cleaner to clean the room straight away. Do not forget the confidentiality statement because it's a key step. And then you can start with the cockroaches. So I can see that you are hitting the cockroaches. Can I know where are they? And you can also ask that how long you are seeing the cockroaches. Has it ever happened before? Do the cockroach also crawling on you? And just because you have found visual hallucination, you have got tactile hallucination, rule out auditory hallucination. Just ask, do you hear any voices that others don't? So once you have done the perception question, then you can go into your usual aseptic J3R. So start with the questions, how is your mood right now? At any times you feel very high, and do you, and then ask about sleep and appetite. Ask about, do you have any thoughts of harming yourself or others? Then you would be asking all the delusion questions we discussed with you. Ask about thought insertion, withdrawal, and broadcasting. Then you ask, do you think you need some medical help? That's for insight. Let's assume there is a fire in this room. What would you do? That's the judgment question. And then ask about the cognition question. Lastly, if you still have some time, ask about SADMA, which is a smoking and alcohol question. And then ask about any other recreational drugs because patient can have a drug-induced psychosis. So very important to ask about recreational drugs. And lastly, finish with any past medical history, any past mental health condition, any family history of mental health condition. Okay? And then you can just go with the MSc presentation, just like I have done. Now, although Dr. Mean, you mentioned about a delusion of persecution in here, it's not actually a delusion of persecution. Paranoid or delusion of persecution is mostly about if someone thinks that like constantly they keep on thinking that someone is trying to spy on themselves, someone is trying to harm themselves. So if you ask that question in the exam, that do you think these cockroaches are trying to harm you? If you ask these questions directly and if the patient answer yes, that's the time you can justify that yes, this is a delusion of persecution. Otherwise, we would not say that. Okay. So the marking is like this. So every task you get a mark of 0 to 7. And out of 0 to 7, you need to get at least 4 to pass this task. Okay. So same thing happen in here, and then you get a global score out of it. The approach that you have during these cages, some candidates can be very rude. So now I know that when you work in your country, many of you are very rude with this, with your patient. It can be like you are going through something bad, or there is a lot of patients, right? So sometimes you can lose your temper. Now, that's not the case in Australia. You can't ever lose your temper when you work in Australia. Whatever happens in your life, how much trouble you are in, that doesn't make any difference to this. So your approach forms the vital part of your mark in any case that you are going to do. If your approach is bad, if you have done everything right, you will still fail that case globally. Every time you finish a case, once you get out of the room, the examiner will ask the role player, how do you like this candidate? How was his approach? If that role player say, I don't like him, I don't like her, you will fail that station even everything is right. So it's a very important thing. A lot of people, like even a lot of course mentors, they don't even know these things. They don't even say these things to their students because these are not something which even been shared by AMC. But that's where you get filtered in the exam. So if you don't have a right approach, you will fail the case anyway. So your approach, even though that's not a task, every time you will see that there is a mark sheet. So if you have ever seen a mark sheet, the AMC clinical send you will always get a mark from your approach. So if approach is 0, and if even these are 7, globally you will fail that case. Okay? So how Dr. Mean has done, like his approach, I would say that's one of the ideal approach we would like you to have. Okay? No, Dr. Toshin, you don't have to ask all questions. It's the important questions that matters. Your main task in here is presenting MSc. As long as you have got all the information for aseptic J3R, you're good. You can just go into the second task. So good question, Dr. Saida. When a patient, so the role player, like when I was doing the case, I keep on constantly asking men that, do you also see the cockroach? But the thing is to avoid. Smartly avoiding something is really good, a good thing. You don't need to answer the question, right? But you can't be also mean to the patient. There is a way to respond to these kind of things, and it comes with practice and experience. Like if you have seen how Mean has done it, so he was just saying that every time I asked him that, like, how can you see the cockroach? He just went into some other questions, or he just makes sure that I don't feel like that I'm getting judged, but also he just makes sure to not answer that question. So you don't answer that question. You just say that like, let's say I asked, can you see the cockroach? You can always say, oh, I'm so sorry that this is happening. I'm going to make sure that a cleaner is on the way. So say something that that's not exactly answering this question, but saying something will make sure that you are not mean to that patient. Okay? Yes, there is a timer in every station, but you would not be able to watch it. So you don't know, you can't see watch, you don't get to see you don't get to take your watch in the exam room. So you don't actually get to see the timer. But there is a bell which will be rang when your time is up. No, that's fine. So sometimes we need to say these things just to keep the patient calm so that we can actually get some answers from the patient. So it is fine. It is not agreeing to the patient that, yes, there is cockroach in here, we will just say, yes, we are going to call the cleaner, because that just settle the patient, and that's fine. And there will be no cleaner coming in this room anyway. If it is a psychotic question, like this case is a psychiatric case, like it could be a schizo, it could be delirium, anything. If it is a psychosis case, you have to ask all the delusion questions. Yes, that's a good thing, Dr. Saima. So caring for the patient comes first. So that's why, because Dr. Min did not ask me when he started the case that, hi Sam, this is Dr. Min. I'm one of the doctor in this hospital. I can see that you just had a surgery. How are you doing with it? Are you in any pain? See that this is important, and it means that you don't care about passing this case. You care about the patient. Although in your mind you actually care about passing this station as well, but you can't show that. You need to show that you don't care about this case. You care about the patient solely. It should be the case in your real life as well. So think these patients are real, if they are not simulated. If you can make sure that in your head these are real patient, all this good approach and good way of talking will come anyway. It becomes a natural part of talking in that case. Okay. If you finish before time, that's fine, no problem. And anytime if you finish before the time, you can always like ask questions. Like let's say if you have finished 1 minute before your case, and now you start thinking what I have missed. So if you missed something, you can always ask it. You can always use that time. Okay, and that will be counted. Everything that you mentioned during that time will be counted. No, so assessment and presenting, the time is not allocated unless they made this. So some questions in the exam will be like perform psychiatric assessment for 6 minutes. If they write a exact time, that means you have to finish it within 6 minutes. And there will be a bell after 6 minutes. Okay? But if it is not written, then it doesn't matter. We don't need to. So we don't need to say to the patient that we are asked to do a mental examination. So the closer in this kind of case is because you don't get to talk to the patient after this. You will just, when you finish the assessment, you will thank the patient. So you will say, thank you so much, Sam, for all the information. Now I'm going to talk to my examiner. So just that is the closer in this case. So, Dr. Mahin, you don't know. It is a difficult thing, and it's been like that forever. So everyone who passed AMC clinical, they had the same thing. So think that it is a tradition we are following, and it will be followed forever. So you can't actually watch, like you can't see the watch. There is no way you will be able to know the exact time that you have, but it comes with a lot of practice. When you do a lot of role play, you will know how much time you have in that 7 minutes. So it's kind of an experience, and it doesn't happen within a day or so. After months and months of role play, you will understand how much time you have killed. Okay, trust me, everyone does. We can. Now, the thing is that it's not, once you present the MSc to the examiner, it's not actually a good idea to go back to the first case. But if you still have a lot of time, then you can ask some questions to the patient, and you can even tell to the examiner, I'm so sorry that I forgot. this patient also have a persecutory delusion. So you can do that. Everything is permitted during that 8 minutes. Okay. All right. So let's move on to our second case. Who wants to do the role play now? So 2 minutes outside to read the case and 8 minutes inside the room to perform the case. The risk to the patient is high when a patient has got active hallucination, active delusion, or active suicidal or homicidal thought. Very good. Dr. Isabella, I'm just going to unmute you now.
Sir, are you hearing me?
Yes, I can hear you fine. Thank you.
Hi.
All right. Ready for
Good
the
evening.
case?
Yes.
Good evening to you. Okay, just 1 minute. I'll give you the case. So your 2 minute time just started.
Okay. So what is BIB?
Yeah, brought in by.
Okay, thank you.
All right. So this is your patient, Richard. You can start.
Hi, Richard. Good morning. My name is Dr. Isabella, your attending GP. So, Richard, I see that the police brought you in today, but I want to ask, how are you feeling? How are you doing? How can I help you?
Doc, you don't need to help me at all. I'm totally fine. I just don't know why the police has brought me here. I don't know because
Okay.
I'm
Mhm.
always on the street, so they don't need to actually bring me here every time. So what I would
Okay.
suggest that you can let me go to my street, and you can actually use your time to some other patient.
Okay, Richard, I understand your concern, but the policemen were a little bit worried about you, and I also see that you have an injury on your leg, so that's why you're here. Would it be okay for me to ask you a few questions before I can let you go?
If you really want, but I don't have any injury. I'm fine. So where is the injury they are talking about?
Okay, Let me ask you a few questions, and then after that, I can address this concern of you. Is that all right for you?
Yeah,
Okay. So, Richard, before we start, I just want to say that this consultation is fully confidential. So, unless it is harmful for you or others, all right? So, Richard, you told me that you live on the streets for how long?
I can't even remember. I think like I was always roaming around this street forever.
Okay. And were you doing anything today? Perhaps you just fell or injured yourself in any way?
No,
No? Okay. All right. I'm just gonna ask you a few questions about your health in general and about your mood. For example, how has your mood been recently, Richard?
it's been perfect.
Perfect. All right. No increase in your mood or like sad mood?
No,
No, okay. And this next question might be a little bit weird, but do you see, feel, or hear things that other people don't?
this is a tricky question, right? Um, I don't know that if others also can hear them, but definitely like
Mm-hmm.
there are some people who keeps on talking to me. They're
Okay.
still talking
And
now. Can't you hear
they're
anything?
talking now. Mm-hmm. What they're
Yeah,
telling you now? Okay.
they're just saying that like I just should go out of this hospital. Someone might just kill me. So I know that they
Someone
might
might
not be
kill.
real. Yeah, but
Mm-hmm.
what if they
Mm-hmm.
are? I just don't know. They
Okay.
keep on saying
All
these
right.
kind of things.
Mm-hmm. And do you ever see anything that you think other people don't see, or it's just the voices?
Just the voices.
Just the voices. All right. Is it just one voice or more than one voice?
It's like like multiple voices. Sometimes a woman comes in, sometimes a boy comes in. So there are just multiple people.
Mm-hmm. Okay. And about these voices, a part of them telling you that someone might harm you, do
Yeah,
they ever tell you something else, like trying to convince you to do anything?
no, they haven't started saying that, but they might.
Okay.
They just know
Mm-hmm.
everything that I think. So I don't know how they know that.
Okay. All right. And Richard, do you ever felt or thought that you had some kind of special power?
No, I wish I had, then I
No.
would just stop these voices. They're just like nonsense.
Okay. I see. I'm so sorry to hear about that. And do you think people are trying to talking about you?
No,
No.
sorry. I'm
Okay.
just trying to hear them. So what? Sorry? No. I
Okay.
can't do that. You just need to leave me alone. Just go away.
Okay.
Just talking to the
Okay,
doctor.
Richard. Try to stay with me, all right? If these voices are too distracting, you can just tell me, but can we continue?
Yeah, sure. Sorry, doctor.
Okay. All right. Richard, I know that you don't want to be here, but do you think you need some medical help in any way with these voices or with something else?
No, I know that like no one can actually help me. This I have to figure it by myself.
Okay. And can I ask you just simple questions? Do you know where this hospital is? What is the name of this hospital?
No, I don't know.
No. Do you know what day it is today, Richard?
Yes, I think it's Sunday.
Sunday. All right. And do you know who I am? Why am I asking all of these questions?
You're the doctor.
All right, that's perfect. And Richard, just a question about something hypothetical. This is hypothetical. It is not happening right now, but let's say that there's a fire in this room. What would you do if there was a fire in this room?
No, I will just run.
Run. Perfect. Okay. And do you like your life in general?
Yeah, I really love it.
Yeah. Mm-hmm. Have you ever tried to hurt yourself in any way recently or in the past?
No,
No, all right. Thank you so much, Richard, for your information. And now I'm gonna talk to my examiner. So, dear examiner, my patient's appearance is he's not well dressed. Here his clothes are all ripped up, and he appears yeah, he's talking to people and he's anxious and he's cooperative, but his speech is normal in rate, volume, and tone. He does not have a disorganized speech, very organized. Emotion-wise, his emotion is not affected. There's no, the mood is normal. He does have hallucinations, mostly auditory hallucinations. There's no visual hallucinations. And in general, the content of his delusions is that people are trying to harm him. So there's a persecutional kind of delusion. And he does have insight, but I just think that he's a little bit helpless. But he does think that he needs some help, and the cognition is impaired. He doesn't know the day or where it is, but he knows who I am. The judgment is not affected. It doesn't seem like there's a risk for his patient. And the rapport was good. I was able to maintain good rapport with my patient. And the reliability, it's impaired as well because he has these hallucinations. So I would just try to obtain a collateral history from someone in his family if we can get a record of
Thank you.
something like that. All right, thank you.
Time up, doctor. Very good. Very good, Dr. Isabella. Very, very good. So it's really good how you have done the case. So, and I like the way that like how you're not getting affected by anything. Even though you are slowly progressing, you did not kill time anywhere, which is really perfect. Okay. So if you can do the case just like how you have done, there is no way they can fail you. Okay. So the important thing is that how gentle, how calming you can be. Having a calming effect on a patient makes a huge difference, not only just in AMC, in your real life. So if you can talk in a calming voice, and you don't get offended by anything the patient says to you, and you keep on reassuring the patient, like everyone will love you, right? So not just as a doctor, as a person as well. So that's really important. And I think like Dr. Isabella has done really good in that perspective. Now, few things I would add in this case. So as part of the history, because again, this is a psychotic case. So patient must have psychosis because he's hearing voices. When that is the case, we can't miss any delusion question because there might be some delusion positive in this patient. So which was positive in here? So if you ask me about thought broadcasting, I would give you a positive finding in this case. Now, do you think like because you guys are also listening to the role play, do you think is there any other delusion this patient had? So persecutory delusion was there, but was there anything else that I just mentioned very slightly? So if you are not like if you listen to me carefully, then only you will be able to pick it up. Otherwise, you will just mix it up. What was it? Not guilt. Paranoid was there. Reference, no. Reference will be patient will say that people are talking about me. Broadcasting, no, I didn't say that like if my thoughts are getting broadcasted. Thought withdrawal, Dr. Naduni, that's it. It was a thought withdrawal when I said that I don't know like how they know everything. Uh, Whatever I think that they seem to know about it. So that is what thought withdrawal is. So if a patient thinks that whatever they think, someone is also somehow knowing that, it means that thought is getting withdrawn. So that's the thing, like in exam, time to time, the role player will give you information. And if you don't know what they're giving, you will just miss it. And missing this important information can affect the mark in the exam because there are only few positive findings you get in each of the case. And those positive findings should not be missed, especially in MSc. Okay? Although it looks easy sometimes, but the difficulty is here, where you will be given information, and some of the information is actually the key steps or key points in that case. And if you are not paying attention, or you are just like trying to think what would be the next question, you will just miss that part. So in this case, the one of the thing which was really important to find out was that thought withdrawal. Other than that, I think, Dr. Isabella, you have done everything right in the history and all. The other thing I would say that mood, if a patient say that my mood is perfect, you are supposed to use that word. That when you say that as part of patient's mood, he said he's feeling perfect. So that's the exact word patient has mentioned. That's why it's a good idea to write aseptic J3R on the paper in front of you. And then every time you get a finding, which is important, like mood perfect, just write that so that you don't forget about it. Okay. So for MSc, it is a good idea to write the positive findings because at the end, you can forget a lot of things that you actually found. It's also important to mention a little bit about that ulcer. When I said that I can't see any kind of injury in my leg, rather than just saying, no, I'm not going to talk about that, it's a good idea to just to say that, I'm so sorry, Richard, that you don't even know where the injury is, but the police has mentioned that you have got a significant ulcer in one of your leg. So first, I'm going to ask you a few questions, and then I will take you to the treatment room. Or because this is emergency department, you can just say, I'm going to assess that wound and make sure we do a good cleanup and dressing of that wound. How that sounds. So just say that you would do this because that actually means that you don't just care to pass this station, you care for this case, for this patient as well. So caring comes with a lot of things, not just what is the task. If something like a ulcer or patient came with a head injury, now talking like all the like bullshits, you need to mention that I'm so sorry that you have had an injury in your head. I will make sure that you get full assessment in regards of that, and also we'll do a dressing of that wound. So just say that thing, and that will be covered. Okay. So do you guys have any questions in this case? Yes, asking about alcohol, recreational drugs is a good idea, but if you miss that, in this case, they can't fail you because that's not a part of MSc presentation. So if you have time, definitely do that. But if you're running out of time, you can miss these things. These things will not affect your mark that you're going to fail. No, we don't need to ask for obsessional thoughts or overvalued ideas unless the case looks like that. So if there is a case of eating disorder, then yes, obsession or overvalued ideas will be really important to ask. If this is a case, because a stem usually gives an idea that what's the case all about. So if the case looks like that it could be OCD or it could be a eating disorder case, then yes, you have to ask. Otherwise, we don't need to. Yes, Dr. Vivavi, yes, you can do that. So they give you a paper and a pen in each station. You can write little things there. Yes, Dr. Qasim, you only mention differential diagnosis when it is a task. You don't do anything extra because you will not be given any extra mark for that. So only thing that you need to do is what's been asked in the task. Okay. So I'm very happy you guys are asking a lot of good questions. So that's really good. Most of you just a beginner, but I hope that you already know how to ask questions, which is really good. Okay. Who wants to do the next one? Dr. Arthur? Okay. Let me unmute you.
Hello, can you hear me?
Yes, I can hear you. Thank you. Okay. Let me give you a case. All right, Dr. Arthur, this is your case. Your 2-minute time just started.
Thank you.
All right, so this is John, your patient in front of you. You can start.
Hello, John. Good evening. My name is Arthur. I'm one of the doctors here. Um, Please tell me, why are you here?
I don't know. Just
Oh,
just let me go home. I don't want to be here.
I see. I'm sorry to hear that. We don't want to keep you here against your will. But is it okay if I ask you a couple of questions before I send you home?
Yeah.
Okay, thank you. Thank you very much for your cooperation. Just before I start, I just want to let you know that everything we discuss here is going to be confidential unless it present any kind of harm for you or others. So please feel free to be honest and open to me. Is that all right?
Yeah, sure.
Okay, thank you. So tell me, how is your mood lately? How are you feeling?
I just I can't I can't live anymore. I
I see.
just feel horrible.
I'm so sorry to hear that. Oh, um, is is that affecting your sleep anyway?
Yeah, I can't sleep. I keep on just having nightmares.
Mm-hmm. I understand. And what about your appetite? How is your appetite lately? Did you gain or lose any weight?
I can't eat anything. Just I don't know about my weight.
Okay. I'm so sorry to hear about that, John. I'm gonna ask you some questions that they might sound weird. I just want to let you know that there are screening questions that I have to ask every patient. Is that all right?
Yeah.
Okay, thank you. Thank you for being so cooperative. Um, so you said that you don't think sometimes life is worth living. Is that all right? Is that what you said?
Yeah.
I'm sorry to hear that. Have you ever tried to take your own life or to harm anyone else?
Yeah. I just did just an hour ago.
Oh, I'm sorry to hear about that, John. We're gonna take good care of you. Do you think you need any help with the way you're feeling right now? Do you think you need any medical assistance?
No.
No, I see. Mm. Um, Another strange question, but do you know where you are at the moment?
Hospital.
Also, that's right. And do you know who I am?
The doctor.
Perfect. And do you know what day it is today?
No, I don't care.
Okay. I understand. I'm really sorry that you're feeling about that, and we're almost done. And if everything's okay, we're gonna let you go home. Okay, just keep up with me for a little bit. Let's pretend that this room that we're in catches on fire. What would you do?
We'll just stay.
I see. I'm sorry to hear about that. Another strange question, but sometimes you have the feeling that you can hear or see or feel things that people around you can't.
Yeah, I think like I keep hearing people saying that I'm a murderer.
Okay.
Yeah. Every time I go to the hospital, all other nurses keep on saying that, and I know that they're talking about me
Mm. And why is that? Why is that you feel so guilty?
because I killed a cat.
Oh, you
Was
killed a cat?
yeah, he was under my care, and like I just couldn't save him.
I see.
I know that.
Please go ahead.
I know that I killed him, although everyone's saying it was not my fault. But I know
Oh,
that I'm a murderer.
I see. I'm really sorry to hear that. I don't feel that way, John. I'm pretty sure it wasn't your fault. But we're gonna help you. Do you feel that someone or something might be trying to control your thoughts or actions?
No,
No, that's okay. And do you feel like someone might be trying to spy on you or hurt you some way?
no,
No, that's okay. Uh, and do you feel that you have any sort of special ability or special power that can make maybe people jealous of you?
no,
No, I see. And another strange question, but do you feel like sometimes someone or something might be trying to take thoughts away from your head or insert some thoughts into your head?
no,
No. What about broadcasting your thoughts into, like, say, radio or TV stations?
no,
No. Okay. All right, John. Do you have any medical condition, any health issues?
no.
No. Okay. How's your home and work situation? Is it very stressful there?
It is sometimes. The work is stressful, but I have a good
Oh,
partner.
okay, that's good. You have a partner, and should be able to take care of you in case you need any assistance at home.
Yeah,
Okay. All right, John. Do you take any medications currently?
no,
No. All right, John. Thank you very much for your time. I'm just would like to discuss my case to the examiners. That's okay with you?
yeah, sure.
All right. Dear examiner, I would like to present the case for John, a nurse that was brought in by his wife when he was trying to commit suicide. I can't really assess his appearance, but because he's like this is a video. Sorry, there's no video. But he's been pretty cooperative so far, Even though his speech has a very low volume and it's very monosyllabic answers, he's been very cooperative to me. He described his mood as low and horrible, and the effect is congruent to that finding. There are no clear signs of hallucinations, and his thought form seems to be linear. He does seem to have some delusions of reference and guilt, but no other signs of delusions of control, grandiosity of or broadcasting or paranoid delusion. I can tell that his insight and judgment are impaired, leading to a very high risk of suicidal attempt. He already attempted once, so there's a good chance that he might try to do it again. I believe I was able to build a good report with the patient, and I also believe that his reports are reliable, but I still would like to have a collateral history from his wife if possible. And I would also like to keep the patient in to assess further his history. That's it.
Thank you.
Thank
Thank
you.
you so much, Dr. Arthur. It was really great. So, yep, I think like you've done it really good, and I don't have much of a complaint anymore. So you have started with a confidentiality, which is really important, and also like the reassurance, the way of talking, everything's perfect. Okay, so in this case, one thing would be important to know the duration. So we always find out that how long this is happening. It's also a good idea that to ask what exactly happened initially, because you can actually think ahead that what kind of condition this patient is going through. So rather than asking in the middle that why you feel guilty or what's really happened, it's not a bad idea that when you see the stem, you know that this patient is most likely a depression patient. But it's not a bad idea to find out that I can see that you were trying to hang yourself, and I feel so sorry for that. But now that you are here, we are going to take care of you. And and I want you to understand that everything we discussed today, it is confidential. So, John, would you please tell me what really happened? Why did you want to hang yourself today? So, getting an understanding about the case is a good idea always at first, rather than getting it in the middle or at the end. So, it just makes your case a lot better. But it doesn't matter, it did not affect a lot in your case, but some candidates can get lost. If I was thinking when you are going to ask me that what really happened. So every time you asked a question, I was thinking when he's going to ask me why I wanted to hang myself. So that thing I don't like, the role player would not also like, right? So role player would like you to ask that, like, yes, this guy can see I was trying to hang myself, but he did not bother me to ask that why I really do that. So that's important. So start with that questions and then go ahead with the mood, sleep, appetite, suicide, and everything. Okay. Then other than that, you asked all the right questions, hallucinations, delusion, insight, cognition, judgment. So everything was okay. Then as part of MSc presentation, so yes, the appearance you can't see. In this case, most of the time in the appearance, you will find out that patient will not maintain eye contact. So depressed patient usually look down when they talk. So make sure that if in the real case, don't forget to mention that if patient is giving you that information. Then as part of his speech, yes, it was a slow, monotonous speech. Emotion, according to the patient, it was horrible. Affect was congruent. Then as part of perception. Now, in this perception, it is sometimes confusing whether patient is trying to give us hallucination or delusion. So if you are not sure in the exam, you can always ask it. How we ask it is that when I say that I can hear people are saying I'm a murderer, I know that they're talking about me. So when I say I know they're talking about me, it goes towards delusion of reference. And when I say I can hear people are saying I am a murderer. Now you want to clarify that because you don't want to miss hallucination in this patient. So you can always ask that, well, John, so do you think you hear the voices only, but you can't see anyone just talking? Is that the case? So if patients say, yes, I can only hear voices, but no one is around, that means it's a hallucination. Okay. And then you can also clarify the delusion of reference that you told that the nurses, whenever you go to the hospital, they keep on saying that they keep on talking about you. So you can actually see the nurses there, right? But you can't hear them saying anything, but you know that they're talking about you. So that's when you clarify these two things. So it's a good idea because it's tricky to understand what's really happening, whether it is a hallucination only or whether it is both hallucination and a delusion of reference. So if you are not sure or the role player is not giving you the exact information, you can always clarify with the patient. Okay. Other than that, everything was okay. So insight, cognition, judgment, everything you said, it was fine. Okay. Thank you. So do you guys have any questions? As part of reassuring the patient when he says, I killed the cat, or it was my fault. So it's saying Dr. Arthur has mentioned. So you can always say to the patient that, I'm so sorry that you feel that way, but I'm sure it was not your fault. But you are here with us and we'll try our best to make sure you feel right. So say something nice to the patient. Doesn't mean doesn't has to be a specific thing, but say something nice. Any kind of delusion can come in the exam, Dr. Isabella. So that's why we say that try to ask questions of delusion if you can, because they can give anyone. So all the things we are doing today, all of them comes in exam. No. So only time you would give diagnosis and DD is when it was asked in the task. In a suicidal case, if the management is not a task, you don't need to talk about reporting it to the police. Not at all, Dr. Bora. So doesn't most of you are from Asian countries. So and most of your accent is not Australian accent. Now, does it matter? Really no. So as long as your role player can understand you, as long as they are able to answer your questions, because that means you're doing it right, as long as they can do it, you're fine. Your accent doesn't matter with your scoring because an examiner know that you are from Asian countries or you're from overseas and you don't have Australian accent. So they're trying to take you in Australia, so they should be a little bit flexible for that, and they are. So the problem is some of you, when you talk so loudly or so fast that it becomes very difficult for anyone to understand. So don't talk too fast. A slow, clear speech is much better, but you can't be that slow that you are running out of time. I liked the pace of Dr. Arthur, Dr. Isabella. So any of you who has done the case today, I liked how the pace was. So these are good way, but sometimes I come across to candidates initially when they're a beginner that I see that they talk so fast that I can't even understand them. So in that situation, definitely we are going to tell you that, well, I think that you have a bit of faster speech. You need to lower it down. You need to make it a bit slow. So, but accent doesn't really matter, okay? Because like everyone who is here, most of you are going to pass this exam and none of you have Australian accent, right? But you will pass anyway. So it's all about how you prepare. It's all about how much role play you do. And with this all role play, your accent will not change a lot, but your flow of speech, like how you talk, that will change a lot. Okay. So as a beginner, everyone is struggle. There is nothing shameful on it. Try to do a lot of role play. Everyone improves. It does. So sometimes the psychiatric cages are made up like that. So they can give you a hard time. So if they're giving you a hard time, don't get offended. Think that this is the case. For suicidal patient, we normally just ask that, like, do you have any specific plan to commit suicide? So that's one of the questions we should really ask. Otherwise, nothing really important. This is not a MCQ class, Dr. Muhammad. This is a clinical class. If it is a management task, then yes, we talk about all the helpline and everything. But when management is not a task, we don't need to do that. Okay, so if they keep questioning and delay the time, what should we do? It is a very tricky thing and it can happen in the exam. If they keep on doing that, all you need to do is to keep the calmness in you and try not to answer their questions a lot. In that case, just make sure that be smart and ask your questions. So you just need to take over. Remember, throughout your life, when you are a doctor, you are the boss, and your patient will not boss over you. They can ask questions, but they can't be the boss. You are the boss there, and you will control the room. So, and that doesn't mean that you are mean or rude. That is how it should be. Okay. So if they are just asking a lot of questions, you can always just bypass that question and don't be mean to the patient. Just say, yes, I understand that, or you can say, I really appreciate your questions. It is a very valid questions, but how do you feel about your mood these days? See what I just did? I made sure that I said something about that question, and then I just made sure I get my answer because I really need that answer. All right, so let's talk about management. So sometimes management can be a task in the exam. So there is a specific way of talking about the management in here. So when we talk about management, we mention, so management includes everything. It includes the diagnosis, it includes whether you want to do any investigation, and definitely the management as well. So first, when you finished MSc presentation, you would explain what the patient has. So if you get major depressive disorder, so you will just say that, thank you so much for all the information, John. According to the assessment, you are going through a major depressive disorder. It's a condition where a patient goes through an intense sadness, low mood, sleeping difficulty, and suicidal thoughts, lack of appetite, lack of concentration for at least 2 weeks. And that is the time we say that patient is having a major depression. I understand that why you feel this way, that because you feel guilty about killing a cat. I want you to understand that you have been already mentioned that you are not guilty of this. And it means that you haven't done anything wrong. It is not your fault. Sometimes when we are a doctor, sometimes this thing can happen. There are sometimes we can't do anything to save a patient, and there is nothing wrong with that. But now that you are here, we will do everything in our power to make sure you feel right like before. because you have these active thoughts of suicide, you are not safe enough to go home. So I would like to admit you in the hospital. I will call my senior who will come and review you. And also a mental health team will be informed. In the meantime, I'm going to take some blood and we will do some basic blood test, blood count, your inflammatory marker, blood sugar, thyroid function, and the drug screening. Not everyone needs a CT scan of the brain. And toxicology screen is only when a patient say that they use some recreational drugs. Once the mental health team comes, it will involve a psychiatrist who will come and ask you more specific questions to find out whether you need to be admitted in the psychiatric unit. Okay. They might also want to start some medication to help you to go through this time. There will be a psychologist who will guide you, who will listen to your thoughts, who will help you to deal with this emotional time. A mental health nurse will also assist you during the whole time you stay in the hospital. Once you're ready and you are stable enough and you no longer have the suicidal thought, you will be advised to go back to home. And in that case, even a social worker will be arranged and a community mental health worker will also will be in touch with you to see how you're doing. You will be reviewed by your GP as well regularly to make sure you can tolerate the medications and you're feeling well. So that's mostly the management that we are supposed to talk. Okay, so you can always make it very long management, but the basic is this. Okay. Yeah, so there will be more psychiatric role play classes because this is just our first class. And there are four more classes on psychiatry, which is part of the course. And after that, we will do a psychiatry role play as well. If diagnosis is a task, then yes, we should ask about the mania question. Otherwise, if it is only MSc, then no need. Okay, so that's mostly about the management. Now, I want to do a different case now. So it will be a video role play, which means that you would be given a video of conversation between a doctor and a patient, and you need to find out the specific points. And then after watching the video, you need to mention the MSc. That's one of the case as well. So when you go to the face-to-face case, what they do that in these video MSc cases, there will be a room where you can have a big screen, and on the screen they will play a video of conversation between a doctor and a patient, and you'll be given 4 to 5 minutes to listen to the video, and then during the video you can write the findings on the paper, and once the video is over, you will be asking to mention the finding to the examiner. Does it make sense? So who wants to do a role play now? So this is more easier than asking the history. Anyone? If you're a beginner, you can try this one because this is really easy one. But again, it's important. Yes, doesn't matter if you're a beginner. So yes, Dr. Bilal, I'll just unmute you. Can you hear me?
Yeah, I can hear you.
Brilliant. Okay, so let me just give you the case. So you can read this question, and after you have read that, just let me know. I will start the video.
Okay, thank you. Okay,
All right, so I'm just going to play the video now. So if you don't hear the sound, let me know.
sure.
Video will be stopped. You are supposed to present the MSc to the examiner. Okay.
Sure.
Hello, Robert Smith.
Yeah.
Thank you for coming to see me today. I'm Dr. Stanley. I'm one of the doctors that works here. Obviously, anything that we say is confidential between us and the team that I work with and your GP who's asked me to see you.
Okay.
I hear there have been some problems with your housing. Do you want to tell me a little bit about them?
Yeah, I've had all sorts of problems. I mean, where do you want me to start? My neighbours, police, people spying on me in my street. None of them will admit to it, but my neighbours, it's mainly them at number 9, but I've seen them talking to the ones at number 6 and across the road as well.
So when did things start to go wrong?
I don't know. I mean, you'd have to ask them. Well, like when they started properly, like deciding that they wanted me out of the street. I think it was a few months ago. It's been going on for months.
What makes you think they want you out the street?
Well, it's the harassment. It's the spying on me, putting bugs in my house, in my phone. And that at first they thought I couldn't hear it, but now they know that I know that they're there. Saying things about me through the window. Talking about what I'm doing. I know they're doing it. And whenever I leave my front door, woman at number 7, she's always there. She's clocking where I'm going and what I'm doing.
Why do you think they're doing that?
Well, I don't know. They just. I think they want me out.
Mm-hmm.
I think they're testing me, and they're trying to find out how far they can push me. Basically, it's all part of some test. I don't know why. I don't know what for. You'd have to ask them. That's what I've said to the police time and time again. I've said to them, why are you asking me these questions? Why don't you just talk to them?
You said that your phone was clicking. What was that about?
A landline.
Your landline?
Yep. Somebody rings me or I ring somebody. Between 7 and 10 seconds in, I hear click, click, click. Click, click, click every time.
Any other explanation for that?
I don't know. What else? Well, it could be, but every single time, and then they're talking to me, and then they know what I've been saying down the phone.
How are they talking? Where are they talking to you?
Well, I can hear them next door. Oh, he's on the phone again. Oh, he's reading that book again. I can hear them saying it, and they know that I can hear them, and that's why they're doing it.
Okay, so just to summarise at this point, your phone's something's happening to your telephone. You can hear your neighbours talking about what
Yep.
you're doing, making a commentary on your actions
Every day.
every day, and you feel that there's some sort of reason for all their actions doing this. Any other things that you've got problems with?
Following me down the street. People following me when I'm going to the shop. It's happening more and more. I mean, I've tried to explain to my friends about it. They get really agitated. They think I'm off my rocker, but they don't see it. They're not living with it every day.
Okay. So your friends are worried as well?
Yeah.
So
Well, worried or I mean, I don't think they're on it. I don't think, but they know a lot about what's been going. I don't know. Maybe the police have been talking to them or something, or maybe my neighbours have been talking to them.
Okay.
I don't know. Again, you'd have to ask them. But it's hard. It's hard to know. It's hard to know who to talk to because they all,
So
they're all involved.
So this started happening a few months ago. Has it had any other effects on your life?
Well, yeah.
Such as?
Can't really go out. Well, I can, but I know what's going to happen if I do. So I'm just trying to stay low key. I'm trying to stay out of people's way. I've hardly slept. I've hardly slept for the last, I don't know, I can't remember the last time I got more than 4 or 5 hours sleep.
So what disturbs your sleep?
I don't sleep until, I don't tend to go to sleep until after 2, 3, when I'm sure that they've turned everything off.
Right, okay.
Downstairs, and just can't, I'm worried about it.
Any problems watching the telly, listening to the radio?
Oh yeah. They're using the TV as well. They're using all. They've got all this technology, obviously. I mean, I know there's all these smartphones and whatever now. All they need is one of them, and they can just. But yeah, TV. They've got the local news. If ever I watch that, there's always some little comment. There's always something they say in there at the end about what's been going on. Pretty much every time I turn the TV on now.
Okay.
I mean, it's it's all just the cable, isn't it? So they could, for all I know, they've just plugged it into that.
What do you mean the cable?
The cable TV. It runs down the street. Everybody's got access to it if they know what they're doing.
So obviously, this is all very distressing.
All right, so that's a video. You can present your MSc now.
Okay. Thank you, doctor. Do I need to introduce myself, or should I just give the?
Yeah, just give it.
Sure. Okay, I would like to present the findings of MSc to the examiner. So the appearance of the patient, it looked unkempt, and his speech was very fast, and his emotion was high, and he had problem with the sleep. He was not sleeping well. He did not need much sleep. So all these things refer to elevated mood or mania. And since in his history, it's also written that he's a known case of schizophrenia. So these findings suggest that he is in acute manic attack. And with respect to his perceptions, he is having auditory hallucinations, as he is saying that neighbors are talking about him, and he is also having delusions of reference and persecutory delusions, auditory hallucinations. He's also complaining of, he's also, with his thought process, he's also having issue. He's also complaining of thought withdrawal and thought insertion. And with his cognition, I could not hear anything about the cognition. So sorry for that. And then judgment, his judgment is poor, and insight, his insight, he has no insight, and his insight is also poor. And I would not. I would need to take some collateral history since he's in acute psychotic attack. So it's better to take history, some collateral history, and regarding the risk assessment, I he does not have any he does not have any idea to kill someone, to harm some people, to harm his neighbors, which are spying upon him. And doctor was able to build a good rapport with the uh, client. So that's it. Thank you very much.
All right. Thank you, Dr. Bilal. Okay, very good for trying for the first time. So still a lot to work on, as you understand. So as you do a more and more role play, things will get much better. So
Sure.
in this case, because you get a lot of time, so you can always explain a lot of things in here. So how I would do in this case is like this. So you'll say that, dear examiner, I would like to present the mental state examination of my patient who came with some behavioral disturbance. As part of the appearance, he looks well-groomed and dressed appropriate to the weather, but he was like, you can say that he was disturbed, and definitely he was cooperative, answering questions appropriately. He was maintaining an eye contact most of the time, but he seems to be really disturbed by his neighbors. As part of his speech was normal in tone volume, but at some times it was pressured and loud, but there was no disorganized speech. Emotion was not assessed properly, but as part of the affect, it seems patient is quite disturbed by the thing that's happening around him. Perception, he has visual hallucination because every time there is a phone ring, he hears click, click, click. So let's say visual hallucination, but there was no auditory or tactile hallucination. Thought form was linear. Thought content, he had psychiatry delusion because he thinks his neighbors are spying on him. He also had delusion of reference because the neighbors are constantly commenting on what he's doing. He's talking, all of them are talking about him. He also thinks everything that he thinks that it's getting broadcasted on TV newspaper, so he has thought broadcasting as well. Insight, cognition, and judgment was not assessed. He is in high risk because of active hallucination and delusion. He was so the interviewer was able to maintain a good rapport with the patient, but still they need to take a collateral history from the neighbors or the friends to get the proper idea about what's really happening. Thank you, examiner. So this should be the way to do it. So the confidence in the voice will come when you really know what's happening. So it always comes with lots of role play. When you do a lot of role play, when you know what you're talking about, you will not even need to think about what you're going to say. Okay?
Okay. Thank you, doctor. Thank you very much for your feedback.
Thank you, Dr. Bilal. Dr. Sana, yes, he said that every time phone rings, he hears click, click, click. So that's not normal. So that is a visual, so that is an auditory hallucination, not visual. Okay, so I hope you guys got a basic idea about the mental status examination role play. There are lots of other cases. So we normally give it in our portal when you join the course about some of the cases which is important for exam, but this will be it for tonight. So I'm really happy how many of you have done the role play. It was really great. And you can also understand from this role play that like all of them who did the role play except Dr. Bilal, all of them are not beginners. So don't think that we expect you to be that. We expect you to be like Dr. Bilal, and my job is to make sure Dr. Bilal becomes like the other doctors. And that will happen. And all of them, Dr. Isabella, Dr. Arthur, whoever done the role play today, they were like beginner at times. I'm sure they were not perfect initially. It takes time to make this thing happen. So there is nothing you need to feel that, well, I like how I am going to be like that. So everyone initially, they feel exactly the same how you are feeling right now. You feel overwhelmed. You feel that it's really difficult. You feel, I don't know, like how I'm going to finish it in time. I don't know even how to even talk in English. So that's a very common thinking happens in everyone's mind. So I want you to understand that the common feelings will get better. You will not be like this. So you'll feel the difference. So if you do a role play now and you do it after 3 months of our course, you will see the difference. But definitely you need to work on it. I haven't actually heard anything about bugs on his foot. So that's the end of tonight's session. As I mentioned earlier, that I was going to do a question and answer session. So if you have any questions about the course, feel free to ask. And before we do that, I always like to just give you some idea about the course so that like many times your questions are already answered. All right, so let me share the course details first, and after that, you can ask any questions. Just give me a moment, please. In the website, if you go there, so if you just write firstaidamc.com, the website will come up like this. And in the website, if you go there, so you've got the 5 months clinical course, and you get to see the details here. And this is where you're going to subscribe as well. Now, you don't need to ask for payment invoice from us. You can actually do it from here as well. And it becomes easier for us rather than sending you the invoice. So if you just go for the subscription button, and then if you fill up everything, then you will find out that everything is in there. So you just need to write your name and some other details, and then they will take you to the payment page. And then once you make the payment, you can always ask, just send an email to us that you have made the payment. What's the next step? Now, about the course details, you can see that our January 2025 course, which is the course you are attending now, this is mainly focused on face-to-face exam format because that's how the next 5 to 6 months exams are going to be. If online exams start, we will also start preparing for online examination as well. But right now we are mainly focusing on face-to-face. And that's really you need as well. So First Aid AMC, we have been running the course forever. So it's been, I think, 8 years we have been running the course. Throughout this time, we have gained a huge amount of experience about how the candidate should be prepared for this exam. And if you see our passing score, or if you see how our candidates are passing the exam, you will know that the course has that standard that anyone really needs to pass this exam. Most of our students who pass this exam are first attempt candidates. And that is really a big deal because if we can make sure that you pass in your first attempt, that means we really know what we are doing. So the course has started today, basically. You are doing the course classes, but initial two weeks are totally free for everyone. But these classes will not be done again. So we took a trial class on 21st of December. So we also provided a recording of that class in our Facebook group. So if you have missed that class, go to our First Aid AMC clinical group, and and you can always search it here, and you can just write, let's say, trial class, or sometimes we write review class. So you'll be able to find out. So let's say most recent. So if you write this out, so you can see that this is where we have posted the review session. So you can always search it, and most of the trial class link will be found just like that. Now, so all these 2-week sessions will be just like how we have done today. The schedule is also given in here. So if you see here, so we have given you the schedule. The next class is on 19th of January, where we will do the cardiology class. So there is a link of our YouTube in here as well. So every video that we actually do the free classes will be also shared in our YouTube channel. So course includes everything that you need. You don't need anything extra. So all the notes that we provide, that's really what you need to prepare. There is no specific books that you need to go through apart from the AMC Handbook of Clinical. So we do the full theory based on a cluster-wise approach. When we do our cardiology class, you will see that cluster-wise approach, which is really important to make your preparation concise and smart. We do role play on the cases that we do, and also we do random role play to prepare you for the exam for any kind of questions. Mainly we focus on 2025 pages, but there will be recorded videos and notes of last 5 years in the portal. There are lots of role play videos that we have done throughout the last years that's given as a free to everyone that joined the course. So right now there is 170 videos of previous batch. So it gets added and added. Physical examination plays a vital role for face-to-face exam. So we will focus on face-to-face format, and we will reserve 1 month just for the physical examination class. So we make sure that you are well prepared for that. We also go for some online mini mock exams. We take classes on communication, patient-oriented approach. Recordings are given, so if any of you can't join the live sessions, the recorded classes are given in the portal once you join the course. And those recorded classes will last for 10 months. All other materials like notes and everything will be available until you pass. We also do discussion on job hunting, career pathways, CV, selection criteria, and upper registration. CPD hours, so you can claim total 150 CPD points by adding all our classes for this 5 months, but you need to be a member of any of these colleges. Sometimes membership can be a bit costly. There are lots of other like CPD homes that you can add our classes, which is like completely free as well. You'll be given course completion certificate, and let's say that some of you has got an exam date for February or March. So you can't finish our 5 months, but what we do that once you make the full payment, you get access to the last batch recorded class. So you can see all the last batch classes that we have done, and you can finish the course in your own time, even if you have only 1 or 2 months. The cost is 899 Australian dollar plus 10% GST. If it is difficult, we allow 2 installation if you join at the beginning of a course. Like at the moment, if you want to join, you can always go for installations. Course duration is 5 months. 3 days a week is the class, and we take classes from 8:30 to 10:30 p.m. All of our teachers are working in Australia at the moment, and they're working for a good amount of time. And we have like a immense experience to make sure that you know the current guideline that is available in Australia. So I don't think like there is anything that you need to even ask. But again, Dr. Arush, they don't give always the video station. So it's not always, but sometimes it can be. Yes, you get the notes. Any questions, guys? Okay. So it was very nice to do the role play sessions, and mostly like most of you have done really good. So keep on working, keep on doing the good stuff, and don't get overwhelmed. Just like your AMC MCQ, initially everything will look haphazard, everything will look very overwhelming, but that's just a part of the preparation. It will become better. Okay. So don't lose hope. Make sure to work on the flaws that you have. Make sure to improve yourself in every perspective. Then nothing will stand on your way. Okay. Next class on 19th, I think. Have a look on the schedules. I think it was given in there. Main books or study materials. Only thing you would need extra is the AMC handbook of clinical. That's it, nothing else. Yes, Dr. T, what's your question? So if you're going for installment, then you will have to ask it from us. So you need to send an email to us. And also make sure that anyone who is making an installment payment, it doesn't mean that like you can just like everyone who does installment payment, they need to pay the full amount eventually. So sometimes we come across to students who thinks that installment means that they just want to do 2 months of class and then they will run away. It doesn't work like that. The installment is a way of helping the IMGs who might be struggling with their financial problem. So even if it is an installment, you need to make sure you make the full payment eventually. Okay, whether you do one or no class at all. So registration is open until our 2 weeks free session is done. Yeah, so all the 2 week sessions will be free. Yeah, so you will get the notes in the portal. So if your portal status is pending, it can, because it can take 7 to 10 days to get the portal access. So if you are still waiting for like more than 7 days, just send us a message or an email. That's totally okay, Dr. T. All right, guys. So thanks for listening. Thanks for keeping the patience. And we'll see you in the next class. Have a good night. Take care.